AI in healthcare, promise, peril, and your power. Imagine this. You download a new health app. You're trying to be proactive, get a better handle on your wellness. You carefully enter your symptoms, your history, your habits. Seconds later, an algorithm gives you a diagnosis and a plan. It feels fast. It feels like the future. But what if that advice is dangerously wrong? And what if it's not random, but the result of a hidden bias programmed deep inside the system? Forms autofill, glitches expose hidden code and choices. A shadowed AI parses lives, turning data into judgments. Freeze on the black box. The questions we must confront. Let's be clear. AI is transforming medicine. It's detecting cancers doctors might miss, predicting outbreaks before they start, and helping design treatments based on your DNA. In 2024 alone, AI-assisted radiology and predictive diagnostics made headlines for spotting pancreatic cancer years before symptoms appeared. The promise is real, faster, smarter, and more personalized care than ever before. But there's a darker truth. The same technology that saves lives can also quietly harm them, built on biased data and hidden assumptions you'll never see. The danger isn't science fiction, it's already on your phone. Next, what algorithmic bias means and why it matters. Algorithmic bias sounds technical, but it's really simple. Garbage in, garbage out. Imagine teaching an AI to judge fruit. You only show it red apples, thousands of them. It becomes great at recognizing apples, but when it sees a banana, it calls it a defective apple. Now, replace fruit with people. Medical AI is often trained on decades of biased data that overrepresents one group, typically white males. So when it evaluates women, minorities, or people from lower income backgrounds, it gets confused, inaccurate, or even dangerously wrong. This isn't hypothetical. A healthcare algorithm used across U.S. hospitals managing care for 200 million patients was designed to find those most in need. But instead of measuring health, it measured healthcare costs. Since less money is often spent on black patients, even when they're just as sick, the AI concluded they were healthier. In reality, they were being left behind. A science study found that fixing the single algorithm would double the number of black patients receiving needed care. The algorithm wasn't racist. It just amplified systemic racism embedded in its data. As one researcher put it, healthier white patients were cutting in line ahead of sicker black patients. Bias doesn't stop with race. Women face it every day in digital health. Classic heart attack symptoms were modeled after men chest pain, left arm numbness, but women often experience nausea, fatigue, and jaw pain. Many AI models miss this. In one study, AI rated women with heart symptoms as less at risk, especially if they also reported anxiety. The AI literally downgraded their danger level because of a mental health note. That's not intelligence, that's bias coded into digital form. For some women, that could mean the difference between a life saved and a tragedy. This is the new face of discrimination, algorithmic inequality. A biased human doctor affects a handful of patients. A biased algorithm affects millions. Some AI tools for detecting skin cancer were trained mostly on light skin tones, making them far less accurate for darker skin. Others linked income levels to treatment options, offering better care suggestions for the wealthy. We are building systems that can scale inequality faster than we can see it. Even when AI seems fair, there's a deeper problem: we can't see how it works. These systems are called black boxes. Data goes in, a diagnosis comes out, but no one, not even the engineers, can fully explain how the decision was made. That breaks the core of medicine: informed consent. How can you consent to a treatment if no one knows why it's being recommended? And then there's your data. Every symptom you type, every condition you log, it's all valuable. Most apps bury the truth in 20-page privacy policies. Your anonymized data may be sold to advertisers, insurers, or pharmaceutical firms. HIPAA doesn't fully protect you here. A single breach could expose millions of medical profiles. You might forget the app, but the internet won't forget your data. AI is often called a co-pilot for doctors, but automation bias is real. When doctors start trusting algorithms more than their own instincts, their diagnostic skills can fade. Like relying on GPS until you forget your own city streets. AI should support human judgment, not replace it. Because medicine isn't just about data, it's about empathy, intuition, and the human connection no algorithm can replicate. So, what can we do? Don't fear AI, use it wisely. Become informed users, not passive consumers, with your clinician as co-pilot. Ask the right questions before you trust an app. Is it FDA approved or clinically validated? Does it disclose its data sources? Who built it? Doctors or data miners? What does the privacy policy really say? Does it replace or empower your doctor? Regulators are finally catching up. The EU's AI Act now classifies medical AI as high risk, demanding transparency. The FDA is tightening bias audits, but change is slow. Until then, public awareness is our greatest defense. Every app download is a vote. If we demand fairness and transparency, developers will have no choice but to build it. The truth about AI health apps is this. They hold two futures. One, a world where AI detects disease earlier and personalizes care for everyone. The other, a world where it amplifies bias, erodes trust, and sells your health to the highest bidder. The future isn't written yet. It depends on what we demand right now. So, the next time you download a health app, pause, think, and assess. Embrace AI's benefits to enhance your care, then confirm important decisions with your own physician. Look for proof, read the policy, and never let an algorithm replace a trusted doctor. If you believe this message matters, share this video so safer, fairer AI becomes the standard. Stay informed, like, comment, and subscribe. Share this investigation, and always check AI advice with your physician. My AI doctor clarity over hype, people over algorithms. AI can guide us, but only humans can care.